I'm Alice. Welcome back to Men Health 30, where we never shy away from the truth about men's health, especially sexual health. Have you ever wondered why your erections aren't as firm as they used to be? Most men immediately blame testosterone or poor blood flow. But here's the shocking reality. Research shows that one of the biggest factors is the strength of your pelvic floor muscles. These hidden muscles are like a natural ring. They trap blood inside the penis and keep you hard. And just like any other muscle in your body, if you don't train them, they weaken with age. That's why men in their 50 seconds, 60 seconds, even 70 seconds often experience softer, less reliable erections. But the good news is this weakness can be reversed. In my clinic, I've seen countless men transform their performance simply by learning to strengthen these overlooked muscles. Today, I'll reveal the 5 most powerful Kegel moves for men you can do at home without any equipment to restore firmness, gain better control, and even improve bladder health. Stay with me, because the final exercise is the one most men skip, yet it's the real game changer for lasting firmness. It's like discovering you have a muscle you never knew existed. Over time, you'll begin to feel exactly which muscles are firing, where they're located, and how to engage them more effectively when you need to. This enhanced awareness can mean firmer, more reliable erections, better control during intimacy to delay ejaculation, and even significant improvements in bladder strength that reduce urgency and frequency. Start with 10 to 15 repetitions, holding each tilt for those crucial few seconds. Focus on quality over quantity. It's better to do 10 perfect reps than 20 sloppy ones. As your muscles grow stronger over the coming weeks, gradually work your way up to 20 or even 25 repetitions with consistency. And this is key. You'll notice that your body responds differently. It feels as if you are locking in firmness rather than letting it slip away. Some men even describe it as reclaiming control over a part of their body they thought they had lost forever to aging. Next, we have the prone stretch. For this one, lie face down on the floor on a comfortable mat or carpet with your legs fully extended and your elbows placed directly under your shoulders, almost like you're beginning a gentle cobra pose or preparing to read a book while lying down. Your forearms should be flat on the floor, parallel to each other. Lift your chest slightly off the ground, keeping your neck neutral and your gaze forward or slightly downward to avoid neck strain. From here, engage your abdominal muscles by gently pulling your belly button in toward your spine. Imagine trying to create space between your stomach and the floor and lightly contract your pelvic floor at the same time. Think of gently lifting those deep muscles as if stopping urine mid-flow. This move may not look particularly demanding to an observer, but what it delivers internally is unique and powerful. It lengthens and stretches the muscles in the front of your abdomen, including the hip flexors that often become tight from sitting, while forcing the deeper stabilizers, the pelvic floor, the transverse abdominis, and the lower abs to contract in perfect harmony. That balance of stretching and contraction is what makes this exercise so remarkably effective. It doesn't just build raw strength, it builds flexibility, endurance, and muscular coordination, which are all essential for optimal sexual performance and maintaining erections. Many men who make the prone stretch a regular part of their daily routine report a noticeable reduction in chronic lower back tension, significantly improved posture throughout the day, and most importantly, a stronger, more conscious connection to their pelvic floor during intimacy. That enhanced connection means when the moment comes, the neural signals between your brain, your muscles, and your erection are clearer, faster, and stronger. It's like upgrading from dial-up to broadband for your nervous system. Hold this stretch for 20 to 30 seconds at a time initially, focusing on steady diaphragmatic breathing and gentle but deliberate muscle activation. Don't hold your breath. Oxygen flow is crucial for muscle function. Repeat it 3 to 4 times with 10 to 15-second rests between holds. As you progress over weeks of consistent practice, gradually increase the hold time to 45 seconds or even a full minute. you'll find that your pelvic region feels both looser and stronger simultaneously. The exact combination you need for lasting firmness, better blood flow, and superior control. The third move is the kneeling abdin. Begin by getting onto all fours in what yoga practitioners call the tabletop position, placing your hands directly under your shoulders with fingers spread wide for stability and your knees positioned directly under your hips. Your spine should be completely neutral, not arched like a scared cat or sagged like a hammock, but naturally straight. This position alone helps align your entire body and removes unnecessary strain from the lower back while preparing your core for activation. Now take a slow, deliberate exhale through your mouth. As you do, gently pull your belly button in toward your spine, flattening your stomach without holding your breath or creating tension in your shoulders. At the same time, contract your pelvic floor muscles. Imagine for a moment that you are trying to stop the flow of urine midstream, or visualize gently lifting your testicles or lightly drawing the muscles inside your pelvis upward. Hold this coordinated contraction for 3 to 5 seconds while keeping your shoulders relaxed, your neck neutral, and your breathing smooth and controlled. Then slowly release with control. This movement may look minimal from the outside, but what's happening inside your body is profound. You're activating the deep core muscles, particularly the transverse abdomen, the ones that wrap around your midsection like a natural corset or weight belt, while simultaneously training the pelvic floor to work in sync. Together, these muscles create spinal stability, improve pelvic circulation, and strengthen the neural connection between your brain and your sexual function. What makes this exercise particularly unique and valuable is the way it links conscious breathing and precise muscle control. By learning to contract on the exhale and relax on the inhale, you're training both endurance and coordination, two things that directly translate to more staying power and conscious control in the bedroom. Men who practice this move regularly often describe discovering a new level of awareness of their pelvic muscles they never knew was possible. Instead of feeling disconnected or out of control, they can sense and consciously control those contractions more easily, which helps them stay firm longer and delay climax when they choose, a skill that enhances both their pleasure and their partner's satisfaction. Start with 10 to 15 repetitions, always moving slowly and steadily with full concentration. Quality matters far more than quantity here. Over time, increase the hold to 5, 7, or even 10 seconds as your endurance improves. You can also try variations such as slightly shifting your weight forward or backward to engage different muscle fibers. The fourth exercise is the bridge abduction. Lie flat on your back on a comfortable surface, with your knees bent at roughly 90 degrees and your feet hip-width apart, firmly planted on the ground about a foot from your buttocks. Place your arms at your sides with your palms facing down for support and stability. Take a moment to find your neutral spine position. Now press your heels firmly into the floor, engage your glutes, and lift your hips up toward the ceiling, forming a perfectly straight line from your shoulders through your hips to your knees. This is your bridge position. Hold it steady while maintaining the bridge with good form. Gently push your knees outward as if you're trying to spread the floor apart with your legs or stretching a resistance band. Then bring them back to the starting point with control. The movement should be smooth and deliberate, not jerky or rushed. What makes this move so incredibly powerful is that it works multiple crucial muscle groups simultaneously in a coordinated fashion. You're strengthening the pelvic floor muscles, which help trap and maintain blood inside the penis during erection, while also powerfully activating the glutes, the largest and most metabolically active muscles in your body. On top of that, you're targeting the often neglected hip abductors and stabilizers, which are essential for pelvic balance, stability, and optimal circulation. When these muscles are weak or inactive, blood flow to the pelvic region is often significantly compromised. But when they're strong and responsive, they act like auxiliary pumps, helping drive fresh, oxygenated blood where you need it most for strong erections. The bridge abduction also effectively retrains your body to hold firmness under pressure and movement. By keeping the hips elevated while dynamically moving the knees in and out, you're simulating the kind of muscular control and endurance needed during intimate encounters. This functional strength translates directly to better performance. Start with 8 to 10 repetitions, holding each outward push for 2 to 3 seconds before returning to center. Focus on keeping your core engaged throughout to prevent your back from arching. As you grow stronger over weeks of practice, increase the number of reps to 15 to 20, or add a resistance band around your thighs just above the knees for extra challenge and muscle activation. Men who stay consistent with this exercise report not only firmer erections, but also better pelvic stability, hip mobility, less fatigue, reduced back strain, and greater control during intimacy. One of the most overlooked yet powerful moves is the rocking frog stretch. Start on all fours on a mat, then slowly widen your knees into a V shape, with feet turned outward. Lower onto your forearms, spine neutral, and relax your head. You'll feel a deep stretch through your inner thighs and hips. Once stable, rock your hips forward and back in a slow, controlled rhythm. This unique move stretches tight adductors and pelvic floor muscles that often restrict blood flow and create tension with age or stress. By opening these tissues while engaging the pelvic floor, you boost circulation and allow blood to stay where it's needed. The rocking motion improves circulation, drains lymph, and trains muscles to contract and relax in harmony, vital for sexual function. Spend 30-40 seconds in this position, moving with your breath. Repeat 3 times with rests, and modify if needed. With practice, flexibility improves, tension releases, and many men notice firmer erections, greater sensitivity, better control, and stronger orgasms. The rocking frog stretch works as both a strengthener and releaser, balancing muscle tone, restoring circulation, and supporting lasting sexual performance. Paired with the other 4 moves, it's the finishing touch that takes results from good to great. The one move can take your results from good to great. These are the 5 best Kegel moves to restore harder, more reliable erections after 50. They are not quick tricks or gimmicks, but practical, scientifically proven exercises that retrain your body to hold blood flow, boost sensitivity, and give you conscious control. The key is consistency and patience. Just 5-10 minutes a day can bring visible improvements within weeks, with greater results after 2-3 months. Beyond erections, these moves also improve bladder control, reduce nighttime urination, ease pelvic tension, and build confidence in your body and masculinity. For best results, practice daily at the same time, track your progress, and stay committed. You may be surprised how much stronger and more youthful you feel. I am Alice, wishing you health and vitality. Remember, it's never too late to reclaim your sexual health. If you found this helpful, share it with a friend, and subscribe for more evidence-based men's health guidance.